Think location of symptoms. Central sensitivity is going to have the presence of widespread symptoms, non-dermatomal. Mm-hmm. Where somebody really dominated more by the affective mechanism could look very much like a dysfunction, where it's very localized. And they could actually have multiple isolated symptoms that seem to rotate. I know clinicians have had these in the clinic, have these patients in the clinic. You're working on their hip, everything's going great. You're getting ready for the discharge. And they come in that day and they said, I don't know what happened to my shoulder. Your shoulder? Geez, you never even say anything about your shoulder, and you're like, yeah, well, how about the hip? The hip's not a problem. It's my shoulder. And, they're realizing that they've got this therapeutic alliance with you, and those sessions with you have been geared toward some active coping. And their brain's intuitive enough to know that, hey, shoot, man, they're getting ready for the discharge here on the hip. If you don't get another problem, babe, you're not going to get another visit, right? So let's wake up the old shoulder problem. And that'll get you a couple more visits with this wonderful person who's helping you cope. And so the affective mechanism alone isn't a widespread pain mechanism, but you often hear people have multiple rotating symptoms. They have very stressful lives. They may have a bit of a negative outlook. And if you're doing good, yellow screening, you're seeing self-efficacy and confidence and depression and anxiety and sleep are very much impacted.